7 hours after undergoing hip arthroplasty for chronic hip pain, a 67-year-old woman reports a pricking sensation in her left anteromedial thigh and lower leg. Neurological examination shows a left leg strength of 3/5 on hip flexion and 2/5 on knee extension. So patellar reflex is decreased on the left. Sensation to pinprick and light touch are decreased on the anteromedial left thigh as well as medial lower leg. Which of the following is the most likely underlying cause of the patient's symptoms? Pretty straightforward question. So, but the striking point, if you have to save your time, the striking point to look for here is the patellar reflex is decreased. So whenever you see that the patellar reflex is decreased, go away and mark the femoral nerve. It's going to be the correct answer. And the femoral nerve, the nerve root values are L2, L3, and L4, of which L4 is the one which is mostly concerned with patellar reflex. Okay, so this is a pretty straightforward question. And so even though you can answer the question with just this point, just try to learn, what the other problems we will have if there is a femoral nerve palsy. You can see that there is a problem with hip flexion and knee extension. So the femoral nerve is what supplies the quadriceps muscles, and the quadriceps muscles are responsible for knee extension and hip flexion. Okay, so and the particular distribution of sensations is also important. Okay, so anteromedial thigh. So these are the points you have to look for, but all these doesn't matter. If you see patellar reflex is decreased, you can go ahead and mark femoral nerve to save time. All right, so what about sural nerve? The sural nerve, I would say it's a branch of sciatic nerve, and it's a pure sensory nerve. So whenever it's not tested very much on the exam, but sural nerve is a pure sensory nerve. So you will not have any motor deficits. So when there's a sural nerve palsy. And fibular nerve, okay, what is the other name for fibular nerve? It's the common peroneal nerve. So that is the nerve which is responsible for causing foot drop, right? So here the patient doesn't have foot drop, so that's not the answer. So obturator nerve injury, obturator nerve, I can share a picture with you guys. All right, so that shows obturator muscle is responsible, obturator nerve is responsible for the sensory supply to the upper medial aspect of the thigh. Okay, so it's very easy to remember. Obturator, that's upper medial aspect of the thigh, and it supplies the medial muscles. So medial muscles are the ones which causes adduction. All right, so you can see here that if there is an obturator nerve palsy, you will have sensory loss over the upper medial aspect as well as decreased thigh adduction. That is the medial muscle. So it's easy to remember that way. Okay, so
Thanks for watching. Please give a thumbs up and subscribe for more.